press the record. There we go. So just to note that this session is being recorded. So if you don't consent to being recorded, we do ask that you just go ahead and leave the session at this time. Otherwise, we'll give it just a moment for everyone to make that decision and ensure everyone's comfortable, and then we'll move forward. So again, welcome so much. We are so grateful that you are here. We want to thank you for attending this session of our behavioral health learning event, the first of the day. This will last approximately 1 hour from 12 p.m. Eastern to 1 p.m. Eastern. My name is Nathan Billy, and I'm the Director of Behavioral Health Programs for the National Indian Health Board, and I'll be serving today as your moderator. And again, so grateful to be joined by Andrea Medley today with the Center for American Indian Health at Johns Hopkins. And she will be presenting on the topic of Indigenous harm reduction and decolonizing substance use and addiction. Really looking forward to that topic, Andrea. It's a topic close to NIHP's heart, a lot of the mission and the work that we do. So thank you for being here for us. Again, as we mentioned, the session is recorded. We will have you on mute just kind of automatically for the session. But we ask that you do leave yourself on mute until our presenter specifically asks you to unmute and engage. I encourage you at any time that you want to use that chat function to drop any questions that you have. If you're like me, I like to get the question out while I'm thinking about it so I don't forget it. So we can also, if the question's kind of organic, Andrea has agreed that we can have discussions as it moves along. Or if it's something we need to kind of put in a parking lot, just please go ahead and put it there, and I will keep an eye on that and make sure that we address your concerns and comments and questions and have some time for discussion. As a reminder, we do want to also say to be sure to sign in and complete the sign out evaluation. And that's because we are offering those continuing education credits. That's the way we make sure that you get those credits. So complete that sign out evaluation to ensure that that process takes place. So thank you again so much for your participation. We're excited to begin. And so let's just get started. So Andrea, love for you to introduce yourself and take it away. Looking forward to it.
Alrighty, I'm just gonna share my screen over here. Oh my goodness. Okay, here we go. Everyone can see? Awesome. So Songay Law, good morning, everybody. Good afternoon. I guess it's that lunchtime in between time. My name is Andrea Medley. My Haida name is Story Made, given to me by my late Nani. I'm from the Haida Nation, Haida Gwai, the Doddens, Yaku, Lannis, Raven Clan, and that's where I grew up in my home community. And I'm Haida on my mom's side and mixed white settler on my dad's side. And so right now I'm calling in from the Cherokee, the Cherokee and Muskogee territories here in Norcross, Georgia, but I'm living in Baltimore, the unceded, occupied Piscataway and Susquehannock territories, and I work with the Center for American Indian Health at the Johns Hopkins Bloomberg School of Public Health. So really great to see everybody here today. I'm going to be talking about Indigenous harm reduction and substance use and addiction. And if folks are comfortable, please share a bit about yourself in the chat. It would be great to know where everyone's calling in from and what nation you're from and what your role is. So Hawa to Dr. Haynes for sharing so far. And I really look forward to chatting with y'all. I'm going to share some pieces of information, and we're going to have some discussion as well throughout. And I also wanted to share that this presentation, I've shared it with communities across Turtle Island. I was living and working in British Columbia for a long time. And so I've had conversations just like this all over, talking to people about these topics. And I've heard a lot, and much of what I've heard has been incorporated into this work and into this presentation. And this presentation in particular, I really worked on it with my friend and colleague, Marnie Scow, and she'll be mentioned a few times throughout. So this is our outline for today. This is what y'all signed up for. We're gonna be chatting briefly about some group guidelines. Then we're gonna get into what is addiction, what is harm reduction, and what are some harm reduction, Indigenous harm reduction approaches. And again, you can raise your hand throughout, type in the chat. We'll do our best to answer and then have some dedicated time at the end as well. I'm not going to get into statistics at all. I think we know, as people who work with Indigenous communities or Indigenous people, I think we're all pretty aware that our communities are very impacted by increased substance use, and it's not good. We're experiencing a lot of harms and a lot of negative impacts, and we already know that. So I'm not going to get into that too much. And, but I am going to talk about some things that could be difficult. However, I want to add that ultimately this is a strength-based conversation, and we're going to talk about ways to move forward. So in that regard, I just want to send a reminder to all of us here to really think about how we can take care of ourselves today and when we have conversations about overdose and substance use and addiction, because it's all personal. We've all been touched by these issues, and sometimes it feels like when people talk about these negative statistics that impact Indigenous people and communities, that people forget we're people, and so all of these overdoses that we've seen and all of these issues that we've seen impact our families and community members, that really impacts us. So we're talking about people. I want us to remember first and foremost, and that it's good when we look for to ways to take care of ourselves. So it might be smudging, it might be going on a walk, it might be whatever, eating a bag of chips. I don't know. We all have things we like to do that make us feel good, and let's make some time for that today. So just wanted to touch a little bit on some group guidelines. So I mentioned the first one. I also want to say this teaching that I heard about group work, and so I like it because it rhymes. What's shared here stays here, and what's learned here leaves here, which I like because I want us to share. And if people share something that is personal, or we ask a question, then I think it's important that it stays in this group, which is our contributing to this online group as well. But I also want people to share these learnings. I want people to have these conversations. I think some of my greatest learnings and teachings have been when I bring this home. Well, I talk to my mom, she gets to hear it all, whether she wants to or not. And, we have these conversations, and, you learn more, and you hear experiences, and you can create opportunities for discussion. I think that's so important in this work. We want to come to this work with an open heart and open mind, respect and patience, because it's all personal. Like I mentioned, we all have our own experiences, and sometimes we have drastically different ideas of what we should do about these issues. So I think that's good. I think that's this place for conversation and reflection. So just wanted to keep these pieces in mind. So to start us off, if you want to either raise your hand or maybe just even jump in, we have a smallish group. How do you describe addiction? Sounds like a basic question, but you think about it and you're like, how do I describe it? So who would like to share how you define addiction? How do you describe it in your work to your not patients, your clients? How do you describe it to your family members? Like, how do you describe addiction? So who would like to share? I see someone's coming off mute here. So
distraction.
Absolutely. Who else would like to share? We're all here. I'm sure we've all had to define it once or twice. Are there any brave souls?
I guess I would say addiction is a way to self-medicate for past traumas.
What was the second part? A way to self-medicate or?
For past traumas.
Past traumas. Yeah, absolutely. A way to self-medicate for past traumas, definitely.
I tend to stop and go opposite for some reason. It often happens to me, even with clients. I go to the word sovereignty. And then it allows an understanding of addiction in relationship to sovereignty. And I find the client is able to articulate that way. And so it tends to be the way I have a client professional dialogue is to talk about sovereignty in relationship to addiction so they can begin to explain it to me and with me.
I like that. How everybody for sharing. So I heard, 3 really great examples about it's a distraction, it's a way to self-medicate for past traumas, it's about sovereignty and looking at the relationship between sovereignty and addiction. And certainly all of these things are absolutely true. And I like to ask this question because I also think it really shows that we all have a different definition of what addiction is. And so when we all have a different definition of addiction, it makes it really difficult to talk about what the solutions are. And I had this experience working at a Indigenous opioid task force, and there was about 30 of us, people that did frontline work with people that are using drugs that are homeless. We had policy people, we had housing people, we had epidemiologists and researchers, and we're plunked on this table to say, what should we do about Indigenous people that are overdosing? And maybe you've been part of those types of tables and you can kind of understand how it went. Like, it was very complicated because we hadn't had that chance to talk about what addiction is and what substance use is and share our own definitions to come to a shared understanding so we can come to shared solutions. And so it's not just us that does, us as a group here that has these different definitions. There's the medical definition of addiction, that addiction is a brain issue. We don't call it addiction, no, we call it substance use disorder. And so that is supposed to reduce stigma. So it's, we have this medical definition. We have the criminal definition that, substance use, using illegal drugs is illegal. So those folks should go to jail. Which has been our response for a really long time, especially, which sounds kind of basic and maybe like, is that our response? But I think, thinking about this system of prohibition, yeah, that's been our response. There's a social definition, and, I kind of heard that's kind of what I would summarize what some folks shared is that, it's a social issue. If our substance use or our addiction impacts our ability to kind of do the things that we want to do or do the things that we commit to do, then that is addiction. And then there's also the individual definition. So I think the medical definition kind of relates to this one because we say, well, it's an individual's problem. They're using drugs. They chose to use drugs, so they kind of have to deal with it. We don't have to look at some of the other pieces that might impact someone's substance use, like trauma, like the history of colonialism. So I think all of these definitions serve their purpose, and I think that they're not all quite there. Like, there's a bit more to it, and I think that that's why it's so important we share our own definitions, because it can get really confusing because there's so much out there. All right, so I wanted to share this little iceberg. So my friend and colleague Marnie Scal that I mentioned, I hope she watches this, by the way, we put this together. And so it kind of goes back to what Cheryl was saying about, what is addiction? And I think at the top we have substance use, but you could put addiction there, you could put increased substance use. And so that's what we see at the top. But then at the bottom of this iceberg, or underneath this water, we see all of the different reasons that might impact somebody's substance use that are far beyond an individual person or far beyond, our brains. So we have things like trauma. We have things like intergenerational trauma. And for Indigenous people, how we've been oppressed and how there has been violence against Indigenous people, since the beginning of settler colonialism. And so that's on there too, and how that impacted us in the past, and it continues to impact us today. When we think about things like land theft, when we think about things like poverty, when we think about the lack of housing that many of our communities experience, all these things impact us today and continue to impact our choices and our ability to make choices around substance use. Not to mention things like stigma, shame, and racism that impact our access to care as well. So when we're talking about substance use, when we're talking about addiction, we're also talking about all of these other pieces. So I guess another part of this is the second part of the iceberg. The other iceberg is the fact that, you know, our substance use is not static, that it changes over time and it changes throughout our lives. And I think that is really a hopeful piece and an important piece to mention, because we all have a connection with substance use. You know, it might be abstinence. Maybe we made a choice in our lives to never use a substance, or maybe we, you know, used to use in an increased substance use way or an addiction way, and then we went to abstinence. But maybe not. Maybe we used to use experimentally and then we started using recreationally. Or maybe, you know, once a year we use substances spiritually. There are so many ways that we use substances that we don't really even think about or talk about. And I think it's really important for discussion, because it leaves this opportunity for change, and it shows that, you know, it fluctuates over time. And another thing that I wanted to mention about this is with addiction or increased substance use is that, you know, First Nations people and Indigenous people, we have many unmet pain needs. Like, it's not just that physical pain. We also experience spiritual, emotional, and mental pain that that's really, really difficult to deal with. And pain is not well understood at all, even physical pain. And so, you know, we still need to look at ways of coping and ways of managing pain, and looking at how people can access what they need without shame or stigma. Because sometimes, you know, we say, well, if we work through this thing, or we think our family member should work through some of their spiritual pain, then that will address their substance use issues. But also, who are we to decide for that person? You know, like someone I think mentioned earlier, well, about self-medication, you know, and to me that means coping. And so why do we get to decide that some people's coping mechanisms are not acceptable to us, when, you know, if we think about the first iceberg of substance use, then we're all, you know, just trying to get by. So I think like these are pieces that we can all reflect on. So that's kind of the addiction portion of this presentation so far. So now we're gonna switch gears a little bit. I have this thermometer about how familiar I am with harm reduction. In person, I might do an armometer, but it's hard because we're on Zoom, where you'd say like this would be expert, familiar, and learner. But so expert at the top is if you're like, this is old hat. I'm just here to see what you have to say. Then you might mark there. The middle is you're familiar, you know some stuff, you're kind of familiar, kind of learning. And then the bottom is if you're like, this is a whole new concept, I've never talked about this before, then you might say learner. If you can use the stamp function on Zoom. So if you go to at the top of your screen, I believe it should say more. And then, no, annotate, sorry, the annotate function. Please say someone else has used this before. I haven't used it in a while. Okay, here's my stamp. So I might say I'm kind of in between. I'm familiar, between familiar and expert. So if you can please share your stamp. Thank you, Hawa. Ooh, we got some experts, we got some familiars. Okay, this is great. If you are like, what the heck is this stamp function, then you can type in the chat, but I haven't seen the chat in a while. Okay, thank you so much for your introductions. I just looked at it. Okay, this is great. So we have like a really nice range of familiarity. We have some learners, we have a lot of people who are like between familiar and expert. So I'll be calling on y'all. Just kidding, it's anonymous. I can't even see who wrote it. But yeah, I would love for people to contribute to this next slide, which is like how, okay, so you're familiar, or maybe you're an expert with harm reduction. How do you describe harm reduction? Who can share how you define it? How do you talk about it with people who are like, what is that? You know, when your coworker is like, what are you doing today? You're going to a harm reduction presentation. So how do you define it? How do you describe it? Who would like to share?
I placed in the chat, harm reduction to me means honoring and meeting people where they are.
Honoring and meeting people where they're at. Absolutely. I love that. Would anyone else like to share your definition? You'll have time to share. Don't worry. If you're feeling a bit shy, there'll be more time for some questions here. So absolutely, harm reduction is about meeting people where they're at. When, here on this page, I have some harm reduction supplies. So when we think about harm reduction and kind of what we're told about harm reduction is, if we practice harm reduction, if we provide people with safer supplies like sterile syringes, then that will reduce the chance of somebody getting HIV or Hep C or other bloodborne illness. It'll help people improve their health and have dignity and agency. And that is totally true. And, we're often kind of trying to sell harm reduction by saying that because of those things, it saves us money. And then we also have kind of this philosophy of harm reduction that says it's about respect, it's about dignity, it's about compassion. Both of those pieces are absolutely true. But what I've seen and what I've heard from Indigenous people and communities is that, we practice harm reduction because we care about our people. So it's not just about saving money, it's because we care about our family members and our community members, and we want them to stay safe. So in this conversation, recognizing those pieces, Marnie Scow and I worked off of a previous Indigenous harm reduction model that I'll share at the end from First Nations Health Authority that I had worked with some previous colleagues, but kind of did a kind of re-reflection on what is Indigenous harm reduction to us in the work that we've done with communities. And we think it's about culture and healing. It's about recognizing grief and loss in this work. It's about creating options for people who are using substances and community dialogue. So having conversations just like this. This is a picture. This one is about recognizing grief and loss. And this is a picture that was taken in Vancouver. So the unceded occupied Coast Salish territories in the downtown east side of Vancouver. If you are not familiar with this area, it's an area that is well known for its substance use, people with addiction, people that are homeless, that kind of live in this area. And it's often painted with a very negative brush, but there is a community of people there that really care about each other and are working for positive change, especially in regards to harm reduction. And so this event on International Overdose Awareness Day, which is coming up soon, it's August 31st, was organized back in 2018. And so it was actually a cultural event in that area, and it was put on by this group called Culture Saves Lives. And so Culture Saves Lives is a group of people, Indigenous people in Vancouver that have lived in living experiences of substance use and are actively participating in their culture. And they'll do things like organizing this event. They'll do things like drumming and singing in the downtown east side, where there are a lot of folks who are actively using substances, which is not without controversy, and I'll share more about that. But it's so important because so many people, and also the majority of this population in the downtown east side, or a high percentage, are Indigenous. And so it's Indigenous people from all over Canada, really, and people move there for a variety of reasons. And some of them have to do with shame and stigma, and that people didn't have a space in their home community because they're using substances, or they couldn't access what they need because they need harm reduction supplies, which aren't available. And so this event was really amazing because they had you see these dancers in the button blankets come from Vancouver Island, I believe they're Kwak-Wakiwak, and participate in the ceremony and dancing in this area known for substance use. And a lot of people, might not do that because we are taught certain ways about who has access to culture. And some of them are about protocol and about tradition, and some of them are about stigma and shame. And so it's really important for us to reflect on how we incorporate and make space for people who are using substances, who aren't in recovery, and who aren't in sobriety. How do we include everybody at the table? I'll speak more about that in this next slide, which is about culture and healing. And so we know as Indigenous people and people that work with Indigenous communities, that culture is our strength, that culture is what's helped us through the many crises that we've had as Indigenous people. You know, the crisis of increased overdose, or this drug toxicity crisis, is unfortunately one of many that we've experienced throughout time immemorial. And so culture is our way of taking care of each other and keeping ourselves safe. And so if we think about how we can make space, again, for people who are using substances, then that's a conversation for each community, because every community is different and every community has different protocols. And so sometimes we can adapt things to have low barrier, or as Marnie calls, no barrier access to culture. And that's something that we can talk about as our family, as our community, so that people are involved in that. We have that opportunity for bonding. We have that opportunity for relationship building. And we have that opportunity to connect with our cultural and traditional ways, because we know that those are some of the most important strengths and supports in addressing addiction or increased substance use. The third part of the Indigenous harm reduction is about creating options. And so, oh, there's Marnie in the middle of the picture there. In this picture, we are on Vancouver Island, and we were at an event for, I think it was overdose awareness generally, I believe. And so it was about cultural sharing with our team, an Indigenous team of educators, and with the Indigenous community we were in. And so those folks in the picture have either lived or living experience with substance use. And they're there to talk about how important culture is in their lives, and how it's important, like I said in the last slide, about making space for people to participate. Other pieces of this creating options are about having harm reduction supplies, about having access to sterile syringes and to information that is accurate and timely, to have access to things like Suboxone or other medications for opioid use disorder, to have access to naloxone, to counseling, to treatment services. It's really up to communities to determine what works for you, works for us. But it's really important we have options, because another harm reduction saying is there's no one size fits all, which is absolutely true. And it's true of other experiences as well. And, you know, we often think about this example of taking a medication for your high blood pressure, and you know, there's not just one pill that everyone has to take, and if you don't have that pill, then forget about it, right? We have lots of options. We have suggestions around even not taking a pill, you know, about lifestyle changes. We have all these different things, and so it's really important that we have options for people who are using substances as well. And the last piece is about creating dialogue. And so what I'll say about this is, you know, a lot of times I've seen, and even for myself, like, I haven't really thought about what addiction is or what substance use is since high school or since elementary school, when, you know, we had to do that DARE program. Actually, I say like I did it. We didn't even have it because I grew up in the middle of nowhere. But yeah, you know, like we were taught like substance use is bad. Like if you do a drug, then you're bad, and that's bad, and you're going to get addiction. Especially as Indigenous people, that's what we're told all the time. And you know, and we internalize that. And so it's really, really important that we have time to discuss, so we can unpack some of those opinions, so we can unpack some of those beliefs, so we can hear from each other about what's working. Ideally, when we have these conversations, we have people who either have lived experiences with substance use or used to use substances, so we can hear directly about what works for them and what needs do these folks have. And so listening is a huge piece of this work, and there's so much to learn from each other. And, I've done, there's always some nervousness about presenting, but I used to be like, oh goodness, like, what are people going to ask? What are people going to say? Like, I'm going to this community and they're really believe in abstinence. But when you get people around the table, everyone always has a different opinion. And I've heard people in a dialogue say, you know what, I believe in abstinence. I don't even really believe in harm reduction. Abstinence worked for me, and I think that's what's going to work for other folks too. And absolutely, that's your truth. And that's, one person's experience. And another person would say, well, I used to use substances, and maybe I still do sometimes, but what I really need is somebody to have tea with me once a week to talk about what's going on, and not to talk about myself. I don't want to talk about my substance use. I just want to talk. And a good example of that is, if you are a smoker or you smoke, and then your friend, every time you see them, they're like, oh, Sean, why can't you just quit smoking? Don't you know it's bad for you? Like, don't you know that you stink? It's so expensive. You should just quit. Like, if every time you see that person, that's all they want to talk about with you, heck no, like, you're not going to want to talk to them anymore. Then they're not a safe person. And so it's really about thinking about people as a whole person, not just their substance use, and engaging in conversation as well. So there's different ways of creating dialogue, whether it's at the community level or the individual level. Alrighty, so what can we do? What are some of the next steps here? What's maybe our homework? No one has homework today. Okay, but we can continue to have conversations and to learn from each other, which is what creating dialogue is about. I have a resource that I can share with Nathan at the end of this, who can share with y'all, and I'll speak to it in a couple slides here as well. We can reflect on our understandings and beliefs, and I do this every day. Like, I've changed my thoughts and opinions on things, and sometimes, and it's painful sometimes, but and it's not all about, we hear all the time about research-based evidence, and like, yeah, research is really important. Research doesn't often cover all the things we know, though, as Indigenous people, or need to know. So looking at cultural beliefs, looking at our experiential beliefs, hearing from people who are out there in the world, and having that time to reflect and continue to look up the latest and greatest information. I think that's really how we can continue to learn more and to have conversations. We can work with peers or people who are actively using substances and people who have lived experience of substance use, since they're the experts in what they need. And then we can also work at destigmatizing our language and just being mindful of the language that we use when we talk about substance use. So I put together this little one-pager, which I'll also share with Nathan. So this is based off of the BC Center for Disease Control's they have a language guide that's also a one-pager, but some of it, they haven't updated it since 2017 or 20, maybe longer. So if anyone from there watches this, then maybe they'll take another look at it. So because some of it works, some of it I think has changed even in those years. And I think that kind of speaks to my previous slide about the constant flux of language and our beliefs and our understandings. So we want to be thoughtful, and we want to be person-centered. So sometimes we use language like drug user or addict or substance user, but what these words do is they label people, and they put people in a box, and then they don't allow folks the opportunity to change, because, well, we're always known as that label, which is actually labeling folks as their most shameful and stigmatized behavior, which really doesn't feel great when you think about it like that. Especially in our smaller communities, I'm from a small community, and if you have lived experience and people are calling you these words, then it really doesn't give you the opportunity to change. And so thinking about person-centered language, a person who uses substances, or a person with lived and living experience of substance use, that humanizes the person again, because it recognizes them as a whole person first and foremost. Thinking about this idea, or this term of clean, so even clean needles, We can try saying sterile syringes, because there's this whole idea about clean and dirty. And, you know, at the bottom I have clean, because sometimes if we're using substances, if we stop using substances, people will say, oh, they're clean and sober. But what this does is it has this meaning that if we are using substances, then what, we're dirty. Like, that doesn't feel very good either. And so we can say people are not using substances, or maybe they're on their healing journey. The last thing I'll mention on here is this idea of substance misuse, substance abuse, that's in the titles of many organizations that serve people who use drugs. But who gets to decide what's misuse? Who gets to decide what's abuse? As I mentioned earlier, you know, we don't understand pain very well generally, medically or otherwise. And who is to say that, you know, my self-medication is abuse when that's my coping, that's what's keeping me alive, you know? Or somebody might say, you know, Andrea, you have 5 beers on a Friday, that's substance misuse. Well, to me, that's what works in my life, you know? And so who gets to judge our substance use and decide whether it's misuse or use? You know, any substance use could be seen as misuse or abuse to some people. So substance use is a more neutral term to use when talking about somebody that is using substances. And then the last thing I'll say about this is, you know, if we have our own lived experience, then we can use whatever term we want to describe ourselves. Some words are appropriate for us to use and some aren't. But if we have our own experiences, we can call ourselves whatever we choose to call ourselves, because that's our own right. And an example of this, which doesn't translate so well into the United States, is in Canada, is if you know, I call myself an Indian, or another Indigenous person calls themselves an Indian, then that's fine. That's your right. But if somebody else who's non-Indigenous calls a person an Indian, then that's seen as offensive. So that's a little bit of like a social/cultural difference here, I guess, but it's just an example of terminology we use to describe ourselves. And who gets to use those words? Well, the people with those identities and lived experiences. So here is my resource list. It's very Canadian centric, but yesterday I was chatting with a colleague and he said harm reduction has no borders. So I love that. So at the top, there is the British Columbia Centre for Disease Control has a COVID-19 language guide, which is it's way more broad than COVID, and it has lots of great alternative phrases, like instead of saying this, say this, and it relates to gender and different experiences of marginalization, and just gives us like really nice updated language to use to know that we're destigmatizing our language. It's a great resource to check out. The BC Center for Disease Control also has this peer engagement principles and best practices. So how can we actively and meaningfully include people who are using drugs? That this guide shares some ideas on how to do that, and it was created by people who use drugs. The policy brief of Indigenous harm reduction equals reducing the harms of colonialism is an amazing resource put out by the Canadian Aboriginal AIDS Network, and I refer to it all the time. It really speaks to what Indigenous harm reduction is. From the US, from Bad River, we have the Expanding the Circle of Care. It's about setting up syringe service programs in tribal communities and that community's journey with how they set theirs up, and it offers really great advice and information. And then the last piece is from First Nations Health Authority. My colleagues and I, back in the day, had co-created this Indigenous harm reduction principles and practices one-pager. So those are some resources. It's a lot of me talking, so I'm gonna move to the next slide, which is, so in moving forward, did anything speak out to you? Did anything come up to you that you want to share that you think you can take forward in your role, or that you want to know more about, or just any thoughts or reflections? I want to open the floor here. see someone maybe wrote in the chat. Can you address self-harm? I think, honestly, I think self-harm is, that's a tough conversation because I think it has so much to do with mental health. Like, I know that it has relation to addiction and can be related to increased substance use. But it would actually, Lauren, if you don't mind, can you share more about your question? I think that would help.
I work with Native youth, and some have substance use, but then some use self-harm as a coping skill, and that's how I address it with them. It's a coping skill. Sometimes it's not a very effective coping skill, but I'm just wondering how what you're talking about can fit in, or how the self-harm issues that some of our students deal with fits in with what we talked about today in regards to harm reduction and things like that.
Okay, well, I'm gonna be like really annoying and ask, like, is there anything that you heard or saw that you think relates? Like, because I'm asking because I am not, in all honesty, I don't work with youth and I don't work with the self-harm folks that self-harm in particular. So I would like to hear from you if there's anything, that you think would be like an interesting bridge or that might help in your work.
Well, I don't know if I'm approaching it correctly, but what I do is I let them know, like I said, that it is a coping skill, and yet I discuss with them the realities of it. It does help for a little bit, but then what? Then it's kind of there's shame around the cutting, and the scars bring shame, and so then it kind of feeds that cycle, or that circle of use or abuse. And so that's how I address it with them. I say, I don't like to see you hurting yourself. You're welcome to continue to use that as a coping skill. Let's maybe find some coping skills that are healthier and help you feel better about yourself.
How Lauren, thank you. That sounds really impactful, and it sounds like it's a really, really tough space to be in. And I think it sounds like you are doing an amazing job of supporting youth in those conversations, and especially what you said about looking for other coping skills, and also looking at kind of what is the root of these behaviors. If people are ready for that conversation, then I think then that can be a helpful way of supporting as well. And just having also like a person like you, a safe person to talk to about what's happening, what's going on, and the fact that people can share that with you, I think is very supportive. And it's these small steps that we take that can really help people. And it's hard because when it's such a great issue, we just need that issue to just go away. But these things take time. And so I think recognizing ourselves as safe people and taking those small steps to move forward can be really helpful.
Another thing I wanted to address while I have the floor is when I first came to work here with the Native youth about 7 years ago, I had an assumption that I would need to focus on substance use. And what I found out very quickly, what was needed was actually grief and loss work. And so I started several grief and loss groups with different ages. And I was just overwhelmed by the disproportionate amount of grief and loss that our students had endured. And even and especially during COVID, the number of losses that the students have had.
Yeah, however, for sharing that, Lauren. Absolutely. I think that, as you mentioned in the Indigenous harm reduction framework, that grief and loss is a huge part of this. It can be a huge part of substance use, and it can be, for many of us, it does really impact our lives, and we need a place to take that. We need a place to have those conversations. And so it's amazing that, you're able to respond to the community and really coming with maybe even your own assumption about what people needed, but really hearing and listening to what's happening in the community and providing those services. And I think that is a true harm reduction practice. So how, is there anyone else that had anything that you think you want to take forward and share? I see a chat.
We have a thing, Scott has asked in the chat, are there resources that can help provide examples of ways that we can include those using substances in our cultural practices?
Yeah, thank you, Scott. I have a couple of resources that I can share with Nathan, who can share with the group. And I think ultimately, though, the hard part is, the unsatisfying answer is, there is no one size fits all, and it's really going to look to different in every community about what's appropriate, what's acceptable, what do the knowledge keepers or elders in your communities find acceptable? Are they willing to work with people that use substances? Is there a relationship there? And so I think it really starts with looking at where people are at, working with both knowledge keepers and elders, but also people who are using substances to ask what they need, and really doing that searching and having those conversations, and then thinking about what makes sense. And so, there's so many diversity in our cultural practices as well. That's another thing which makes it difficult to say. But what I will add is I worked with one community, and something that they had said is, well, there's a couple of things here. The first is that they were doing a sweat, and they said, people who are actively using can't participate because it's physically risky, which absolutely that makes sense. But they said, we don't want people to feel completely cut out. We want to include people in some ways. And so they said, the people that are not that are not able or not interested, or to stop using substances for this time, that period that we require, what if they helped us collect the rocks for the sweat? Or what if they kind of stood outside the sweat to take care of people who are coming in, to give people water, things like that. So there's different ways we can adopt things, but I think ultimately it depends on what the community needs and where the community's at. Yeah, Dr. Haynes, uniqueness for sure.
Everyone, we have about 9 minutes left, so there is time for more discussion. Just to remind everyone, you are more than welcome to take yourself off mute. Also turn your camera on. We love to see you if you have the bandwidth for that. If you want to place your question in the chat, we'll make sure that we get to that. And then also every once in a while, maybe we are wanting to keep that question confidential. So you're welcome to send that to me directly as the moderator in that lower right-hand corner. And I can ask your question for you if you prefer to remain confidential. So encourage that.
Well, how about Nathan? The other thing I'll add about that question, which I just remembered I was going to say, is there's different ways of practicing harm reduction as well that we might not even think of as harm reduction. So I've worked in some communities where we had this conversation. They said, you know what, actually, we live in a community that gets really, really cold in the winter, and I drive around at night to make sure that people aren't passed out outside. That's harm reduction. Or, when my family members drinking a lot on the weekend, I want to make sure they're getting proper nutrition that they need. So I make them a meal, or I give them vitamins. So there's different ways of looking after each other that we have that are harm reduction that we've just been doing for so long, or that might not align with the kind of Western or urban ideas of harm reduction. But that is what Indigenous harm reduction is about, is including all of these ways of keeping people in the circle. I'm wondering from the group, is there anyone that's doing Indigenous harm reduction stuff in your community that you would like to share more about? It's always the most interesting to hear from what everyone else is doing.
I just completed working with the schools in Edmonton, and we had 22 eagles fly over our schools as we worked in collaboration. It began during the big fire of Fort McMurray and Slave Lake. We had those big fires, and we had people coming into the city who weren't used to the city. And I grew up in the wilderness, so I know what that was like. How do you ride a bus? What's yogurt? My bigger question that did come up during that time is sometimes with our own Native uniqueness, we don't always understand. I know people have studied Native earwax or enzymes and how we respond to different medication even. And you know, whether we write it as a celebration of being unique, but even the science of being Native, I think is still new. And when I look at harm reduction, I remember talking to the youth about, did you know some of us can be allergic to that? Really? We're really unique, you know? and I didn't have any handouts to give them. You know, things to share, to celebrate that we're Native and our biology isn't the same. And it really came up during COVID too. You know, are we going to respond to this or this the same as others? And I know the CDC and the WHO are so careful that way. But uniqueness, I think, is something that perhaps in the future we could talk about more. Because we're really unique. And to do it in a way that we can celebrate that. But I've had many professionals ask, you know, do we handle marijuana the same, or do we handle alcohol the same? You know, do we have, our biology is so different. And so that's what I would like to see in the future, is that celebration of uniqueness. Thank you.
Yeah, you raise a really important point there, and looking at, you know, celebrating our uniqueness, looking at it as, yeah, we are different, and that's a positive thing, which is kind of counter to a lot of the ways that we were taught through colonialist beliefs. I mean, I see, Tasha, your organization is working with uplifting coming of age ceremonies. The hope is that it strengthens them in their identity and serves as a protective factor against things like substance use disorder. Yeah, absolutely. I think looking back at our ceremonies that, you know, we might have practiced before, we're continuing to practice again, that reawakening, I think absolutely that's a really, that sounds like a really awesome program. I'd love to hear more about it. And I know a lot of communities I've worked with before, and my community, we kind of have lost some of the information on our coming of age ceremonies. So I think looking at ways to revitalize that is super powerful. Lauren?
Yeah, I want to put this out there. I'm not Native and working with Natives. And one of the struggles that I have is when the youth come in and I start to learn about some of the traumas they experience, it's difficult sometimes to convince them that those experiences aren't okay, because they're, for example, I was working with one girl who had been raped, and she shared it with her mother, and her mother said to her, well, that happens to everybody. It happened to me. Just, you know, get over it, kind of a thing. And so if they're coming, you know, to me for counseling, and that's the messages that they're receiving, it's a very delicate process for me to say those things aren't okay, or you know, chronic physical abuse isn't okay. And then in a way, I'm almost saying that their family isn't okay. So I need some help from those who are more knowledgeable in regards to Native culture and how to handle that more delicately.
Yeah, I think that's really a tough question, but I also think that that really comes to the importance of doing this work in partnership and working with uh, um, community members and working with local knowledge keepers and working with, people who are in those supportive roles. I think that, there are definitely many issues that we experience, and that through working with other folks who maybe have doing this work before, that's where I did a lot of my learnings as well, and kind of and if we are non-Indigenous, then having an Indigenous colleague support us as well in different ways. I think those are ways that we can work to address these issues and to make sure that people have the culturally safe, culturally information that has cultural humility to move forward and to be supportive. And I think that there are definitely these really, really tough issues that impact us. And there's a lot of changes that really need to happen. But everybody here, I think, contributes to those changes, and you're all in these supportive and helping roles. And I think that this work is really heavy. It can be really heavy, and we deal with things that are really hard. And so before we end today, I wanted to go back to the earlier piece I said around taking care of ourselves, and what's something we can do today to make sure that we do something nice for ourselves and we feel uplifted. And so that is what I would like to end this by saying, because I know we are just at time here, is to really look out for each other and check in with each other as we go through our days and as we do this work together, and to do something nice for ourselves today. And I'm still deciding what exactly that's going to be for me. Maybe you'll have like a nice dessert at dinner or something. I don't know. I think like before I was talking with a friend about self-care, and I was like, yeah, I should go to the gym. And she's like, a should is not self-care. A should is, something that you're telling yourself you should do. So do something that's just nice and fun, not a should. For some people that could be the gym, but not me.
We are coming toward the end of the time, so just to wrap up, Andrea, thank you so much. I really appreciate your presentation, some really powerful words, and for a topic that's so important in Indian country. If anyone has further interest in harm reduction, in particular, and you have some opportunity to travel, we are having our National Tribal Health Conference at NHB at the end of September. It's the 26th through the 30th, or actually that Monday through Wednesday of that week are the official sessions. But on Thursday, September 29th, we are having a tribal harm reduction seminar. It will last from 9 until 4. It is here in DC. It was a very difficult decision to make, because I know with the pandemic, we've all become accustomed to Zoom meetings and how we facilitate being able to meet with each other virtually. It was a hard decision to make, that we have chosen not to do a hybrid option at this time. It will be entirely in person. But for those of you that do have travel opportunity or are able to go, the sessions, of course, at the National Tribal Health Conference do cost for registration, but the Tribal Harm Reduction Seminar is completely free. That event's on Thursday, September 29th. If you make it to DC, that is a no-cost event from 9 to 4 on Thursday, the 29th. We'll have some wonderful speakers to investigate harm reduction further. So really looking forward to that. We invite you to that. But again, thank you, Andrea. Thank you to the participants for the opportunity to have this conversation. Look forward to more, and very grateful for you. Just reminding you to sign out in terms of your CEUs. The next session will begin at 1:15 or 15 minutes after the hour. It's 1:15 Eastern, but we'll give you a little bit of a break if you're ready to go to the next one. And so at 15 after, those will start up. So thank you all so much, Yakoki, and hope you have a wonderful rest of the day. See you soon.